Welcome to ENT student for a discussion on outcomes of research activity that is being done. You can start now. Yeah, start please.
Outcome research. The emphasis is on instruments relevant to otolaryngology. The instruments described are simply examples for the reader. The authors do not suggest that these are the best instruments in the subject area. The list of recommended reading is included for readers who wish further information.
So your first point is to just go back. So you can't just don't shift it like that. I'll just say, what is that? You are going to see about the research, outcomes of research and patient based and instruments we are going to discuss and examples are there and they just are not the best one. You may have to go further to know about it. Next.
Clinical outcomes research examines the outcomes of treatment of disease. Traditionally, outcomes of medical care are based on the clinical observations or laboratory measurements. While these measures provide useful information for the clinician, they are often of limited interest to patients. This is often poor correlation between clinical outcomes and functional capacity and well-being, which are the areas of most interest to the patient.
So what you should remember, the first point we are discussing is that outcomes of the treatment. So what is the need of the research? The outcomes of the treatment is important for a patient and even for the doctor. Second point is like they're based on clinical observations and laboratory measurements. Third point is they give us information and they often limited interest to the patient. Of course, they don't want much. The patients don't want much to be learning about that. And there is poor correlation between the clinical outcomes and functional capacity. So not every time the outcome and functional capacity are equal, and the areas of interest to the patient need not have any interest about this. Next slide.
There has been increasing recognition that traditional measures need to be complemented by some measure reflecting the impact of the intervention on the patient in terms of health status and health-related quality of life. These terms refer to experiences of illness such as pain, fatigue, disability, and broader aspects of individuals' physical, emotional, and social well-being. Medicine, in particular surgery, formerly had the principal objective of reducing mortality and morbidity. These objectives are usually straightforward to assess.
So what is that you are going to see here? First point. So the impact of intervention on the patient. What is that you are going to do as some surgery you are going to do? What is that impact that is causing on the patient as far as health status and quality of life related to health related quality of life. So that is about the pain you should keep in mind, the fatigue, the disability, and the physical, emotional, and social well-being. That is physical, emotional, social well-being. This is all related to your health definition as far as WHO is concerned. And third point is that medicine, in particular surgery, especially the principal objective of reducing the mortality and morbidity. What is that a patient comes to us, you have to reduce the mortality and morbidity, and they are all straightforward to access. Whatever point I am showing you, just try to point. Next slide.
Now, large proportion of clinical practice is either cancer or chronic disease. There has been little improvement for some time in survival in cancer, while treatments often have associated side effects and functional impairment that significantly affect the patient's quality of life. There is an increasing prevalence of chronic disease with an aging society, and here aims of the treatment are to arrest or reverse decline in function. These factors have led to an increased interest in patient-based outcome measures.
What you see, chronic diseases like lifestyle diseases like diabetes, hypertension, etc., and cancer. These are all the most important things for the patients nowadays. And next point, next slide. I move backwards. And second point. And accordingly, there is improvement in the little improvement in cancer survival. Not much is gained in cancer survival, and you have to think about this patient's quality of life is the last point in that first one. Second one, an increasing prevalence of chronic diseases Aging and chronic diseases are the problems nowadays, and treatment are based on those things. Go back, you're 15 slides. Last point you are seeing here is the patient-based outcome measures are very important.
Uh, At the same time, increased attention is being given to patients' opinion and wishes in relation to their health. Patients should be involved in the decisions about the treatment. To contribute usefully, they need information about the outcomes of treatment, not just in terms of surgical results, but in terms of the possible effects on their quality of life. Financial resources limit healthcare around the world, and increasingly the distribution of these resources is influenced by the benefits received by patients, their careers, and society as a whole.
The first point is very important. Option should be given. You show the first point. And second point is decisions about the treatment. Any patient should be given options that it's like a cafeteria choice. And then decision should be given about their treatment. They should decide about themselves what is the best treatment among the concept. And third point is the outcomes they to in order to contribute. And it's not just like a surgical treatment that is needed. It is also effect of quality of life is very important. Quality of life is very important. Next, financial resources you should be keeping in mind, and the distribution of financial resources is very important. Not everybody can afford. Next point, next slide.
What are patient-based outcome measures? Patient-based outcome measures are, in general, questionnaires that ask patients about their perception of their health. Usually, these instruments are made up of number of items or questions. These items are linked in number of domains or dimensions. A domain refers to an area of behavior or experience such as mobility, self-care, depression, pain, social functioning, and general well-being.
The last point, if you take last but one domains and dimensions, what are the things that are there in life is that behavior, number one, number two, experience, number three is mobility, whether you can move or not, number four, self-care, and pain and depression, social functioning, and general well-being. These are very important factors that you are considering when you're treating a patient. And second point, if you take, there are number of items and questions that is to be put for the patient. What are the patient-based outcome measures? So outcome, how is it going to be after surgery? You should be keeping in mind. And there are a lot of questionnaires for that about the perception of their health. Next slide.
Many questionnaires focus on physical function, such as patients' ability to walk, climb stairs, wash, and dress themselves. Others ask about the impact of health on various areas of an individual's life, such as the ability to socialize with members of their family and friends. These are aspects of health related quality of life. Overall quality of life is influenced by many factors other than health, such as social, financial, and physical factors. Patient-based measures assess only one aspect of quality of life and are not measures of overall quality of life.
So you have to know about the overall quality of life. That is the last point that is given. So there are aspects of health-related quality of life. The third point you could see health-related HRQL is very important. This is one statement that is used always during discussions. Okay. And then once again you take the last point. There are factors like health, social, financial, and physical factors, and these are all there in management of the patient. First point, if you take that they are able to ability to walk, climbing the stairs, washing and dressing themselves, all these things are very important. So others, they should be able to ask about the ability to socialize. Socialization, moving along with all the friends and family is also very important. Next.
Patient-based outcome measures assess some aspects of patient's subjective experience of health and consequences of illness and of treatment. As these experiences are those of an individual patient with an individual personality and lifestyle, they can be objectively verified. This point is sometimes raised as a criticism of patient-based outcome measures, but it should be borne in mind that many clinician-based outcomes are subjective opinion of a clinician.
So you should keep it in mind that some aspect of the patient subject to experience. Subject to is what the patient feels, what the patient feels for himself, and the consequences of illness and treatment. You should keep it in mind always. And then experiences of individual patients, personality, lifestyle, they're all differing. Every patient is different for himself. And there is always a criticism for subjective opinion of the clinician, that clinician based outcomes are the subjective opinion of the clinician. So what the clinician feels is also there. So there are different types of thought processes occurring when you are thinking about the outcome for a patient. Next.
Why use patient-based outcome measures in research? In the early days of research, few, if any, studies include assessment of health-related quality of life. It is increasingly argued now that clinical trials should include patient-based outcome measures, except where it is clear that these are not relevant outcomes. The UK Medical Research Council, the European Organization of Research and Treatment of Cancer, and the National Cancer Institute of Canada all have policies stating that likely impact on quality of life should be assessed, or justification providing for not doing so.
So when you can say a few studies included assessment of health related quality of life. HRQOL is now a point of discussion for every research. HRQOL, health related quality of life. Okay. And second one is clinical trials. They include patient based outcomes where there are not relevant outcomes. So patient based outcomes only are measured nowadays, very important. Like MRC and EORTEC is very important. European Organization for Research and Treatment of Cancer is one EORTEC organization, and also National Cancer Institute of Canada. All these have their own policies. There are organizations having their own policies to know about these research strategies. Next.
Patient-based outcome measures have been used as a primary outcome measure in randomized controlled trials in many areas including cancer and heart disease. They are also useful in providing evidence of the overall value of the treatment in a way that allows comparison with other treatments in the same area or in the other areas. Patient-based outcome measures are particularly relevant in otolaryngology. Head and neck cancer forms a small proportion of our patients, though a much larger proportion of our clinical workload.
In this slide, if you take, so patient-based outcomes are used as a primary outcome measure. So for randomized control trials, randomized RCTs. So this is very important. Patient-based outcome is only used, and including cancer and heart disease, as you could see that. Okay. Second point, if you take, the value of a treatment helps in the comparison of other treatments. So other treatments and other areas you can compare with this patient-based outcomes, and particularly very much important in otolaryngology and head and neck surgery also.
The majority of our patients do not have a life-threatening condition and their morbidity is small. Most of our patients simply want us to make them feel better. In many cases, we do not have reliable, objective clinical measure to assess the outcome of treatment. To justify our treatment, we need patient-based outcome measures to demonstrate the efficiency of treatment improved in HRQOL. We also need patients-based outcome measures to demonstrate the effects of these non-life-threatening conditions.
So you should keep in mind what is this HRQOL, health related quality of life. First point, what you are dealing here is our ENT diseases are not life threatening. The patient will not die if they are not having this one. So what they want here as an ENT surgeon when they come to us, they want them to feel better. So better improvement they want, and they want to live happily. They should be reliable. They should be objective measures to assess the outcome. And it is the improvement of HRQOL is based on patient-based outcomes. And need for patient-based outcomes is important, especially in a specialty like non-life-threatening conditions, especially based on this HRQOL, especially in ENT.
Even when we have objective measures, example closure of